Hello everyone! In the last video, we roughly divided back pain into 4 types, and today we will talk about the pain that comes from the stiffness of the vertebrae. How to understand that your types of pain are specifically from this problem. The first is morning stiffness. That is, you wake up in the morning and it's hard to make the first movements. You want to stretch, shake out your spine to make it easier. Moreover, people with a muscular type of pain want to strain the muscles, massage them. With stiffness in the spine, you want to unwind, lean, move. That is, shake the vertebrae. The pain is most often non-specific in the middle, and one of the main symptoms is limitation of movement and pain with extension. That is, tilting back the entire spine. We may feel a direct compression downward at the waist due to the fact that the vertebrae move poorly and press against each other when bending backwards. Usually for working with this type of pain, any types of manual therapy are suitable when mobilization occurs, that is, improving mobility with the help of manual techniques. Self-mobilization also works well with the help of short morning yoga complexes, like in our video 15-minute yoga. And the prophylactic exercise McKenzie extension, which we will now look at, is very suitable. Since the most restricted and most key movement for the spine's development is backward bending, we will use Romina McKenzie's extension as a basic exercise. This exercise is somewhat similar to the cobra pose in yoga, but performed in a slightly different way. To perform it, lie on your stomach, place your hands at shoulder level, spread your fingers slightly to the sides, and start pushing off the floor with your hands, bending your lower back upwards. It's very important that at this point, the muscles of the back and buttocks are not engaged, because when the back and buttock muscles are engaged, it creates compression in the spinal cord, which doesn't allow the block to develop. If it hurts to perform this exercise, that's normal. Each time you reach the pain threshold, go into it 10 to 15% and then retreat. The task is to warm up and stretch this block. If the exercise is done correctly, after every 2 or 3 new repetitions, you'll be able to go a little further without pain in your hands. If you've reached full flexion amplitude, you can intensify this exercise at the end by exhaling, tucking your tummy and pulling yourself towards the floor like a baby hump. You can also bring your heels together now to enhance the stretch. Breathe in upwards, pull your belly towards the floor as you breathe out. Ideally, each time you should strive to reach some level of discomfort. Repeat this procedure 10 to 15 times until the lumbar region is sufficiently warmed up. This exercise is good for both morning and evening repetitions. You can also do it impromptu, if you have been doing a lot of leaning work or sitting for a long time with a rounded back. Usually after you've done such an approach, the backward bend becomes much easier and you feel less stiffness in the lower back. Another good sign is the disappearance of morning lower back stiffness after a few days of systematic exercises using an extender. McKenzie. If you've decided to work on your spine's lower back stiffness somewhere at work and there's nowhere to lie down, you can perform exercises for spine development. From the video about 3 exercises for back pain from the link above, good health to all and agile vertebrae. Bye.